Symptoms of vascular dementia. Symptoms of dementia vary considerably by the individual and the underlying cause of the dementia. Depression frequently coexists with vascular dementia and can contribute to, or worsen, vascular-based cognitive symptoms. Because the types of dementia vary, there is no single list of early symptoms of dementia to look out for. Each person diagnosed with dementia has different symptoms, depending on what area of the brain is damaged. Mixed dementia is commonly diagnosed through brain autopsy, so proper diagnosis often does not come until after a person is passed. As alcoholic dementia has not been uniformly diagnosed across epidemiologic studies, the discrimination of alcoholic dementia from AD also is problematic. The sign and symptoms of the disease. People experiencing moderate dementia will likely need more assistance in their daily lives as it becomes harder for them to perform daily activities and self-care. People with the disorder may become confused, suspicious, agitated, depressed, fearful, anxious, withdrawn, or angry. Even the sweetest-tempered person with AD can become agitated, paranoid, irritable, fearful, or highly dependent for no obvious reason. The early signs of dementia are often subtle and vague, and can be difficult to notice, particularly for people who live on their own. In the earlier stages of dementia, there are several signs, symptoms, and problems that may be seen. You might confuse directions, get more angry or irritable, or forget to perform important tasks. Health care providers or other people. Staff in the facility get to know each resident, including their particular needs and preferences, which can significantly improve quality of life for residents needing long-term care. The emphasis will be on the care and dignity of the individual to help them live a more fulfilling life. As adequate antibiotic and anti-inflammatory therapies are available, as in syphilis, one might prevent and eradicate dementia. The quality standard defines clinical best practice in dementia care and should be read in full. The key to dealing with dementia is high-quality, comprehensive care that will help the patient feel more comfortable and safe. Although anticipatory grief may help the family, the dying person may experience too much grief, causing the patient to become withdrawn. A series of dementia care certification programs. Many experts in dementia care treat patients with moderate to severe dementia due to Alzheimer's disease with memantine in addition to a cholinesterase inhibitor. As the disease progresses, people will need increasing help with eating, moving, dressing, and using the toilet. Simply click below to enter your details and choose how many entries you want to pay for. People who keep their cognitive skills sharp by taking classes, for instance, or working at mentally challenging jobs also seem less likely to develop dementia. Potential victims often are more confused, physically limited, or wander unknowingly into a sexual encounter. Once you are back in touch with your body and feelings, you will feel more safe, confident, and powerful. The complex relationships shared between different sleep disorders. Anyone who drinks excessive amounts of alcohol over a period of years may get alcohol-related dementia. The column does not constitute medical advice and is not meant to diagnose, treat, prevent, or cure disease. As the disease progresses, patients may begin to sleep during the day and awaken frequently throughout the night. Patients in the early stages of AD may sleep more than usual or wake up disoriented. A frequent need to get up and go to the bathroom to urinate at night is called nocturia. To help you cope with caregiving responsibilities and to manage your stress, it is important that you remember to take care of yourself. International dementia care experts. Services in a nursing home include various levels of nursing care as well as physical therapy in some facilities. Looking for senior care can be stressful and confusing, and you may be unsure where to start. Even simple tasks at home can be difficult to perform, and more external care and support becomes necessary. When you are facing some troubling memory problems, you may immediately believe that it is dementia. A person with dementia may head the wrong way round a roundabout, or even get lost driving home. During the late stage of dementia, a person will need increasing amounts of support and will gradually become dependent on others for nursing care. Other healthcare professionals. People with dementia and their families face similar challenges in finding appropriate and necessary medical and supportive care. As the disease progresses, early symptoms intensify, eventually affecting the ability to communicate effectively and function independently. As dementia progresses, the patient will need more help with everyday tasks and personal care. ADHD medication may help improve the ability to concentrate, control impulses, plan ahead, and follow through with tasks. As Alzheimer's disease becomes worse, symptoms are more obvious and interfere with the ability to take care of oneself. Sleep disturbances are common for people with dementia, and often lead to carers also having problems sleeping. Current research activities and resources. Clinical trials are tests to find out if new medications or treatments are safe and effective in people. Grief counseling can be provided by professionally trained people, or in self-help groups where bereaved people help other bereaved people. Complicated or unresolved grief may appear as a complete absence of grief and mourning, an ongoing inability to experience normal grief reactions, delayed grief, conflicted grief, or chronic grief. During the sign-up process, you can specify how often you wish to receive emails from Medline Plus. Both intramural and extramural investigators may apply for access to CIDR services through a competitive peer-reviewed process. Although most dementias affect people who are elderly, occasionally younger people are diagnosed with dementia. Many experts in dementia care. Early diagnosis of dementia is important to allow you to get the right help and treatments and to plan for the future. After the assessment, the consultant will draw together all the results and determine what is happening. You may not be able to breathe as well if you have alcohol in your system, which could have a negative impact on your results. After further research, FTD is now understood to be just one of several possible variations and is more precisely called behavioral variant frontotemporal dementia, or BVFTD. By tracking how you feel day to day, you will gain a clearer picture of how triggers and wins impact your health.